MXC455. One of the horrible side effects I receive as feedback from my patients who are on SSRIs, SNRIs is emotional blunting. So, are there any treatments for that? Okay. This emotional blunting has to do with too much serotonin in the hypothalamus of the brain. So, I'm guessing you're a provider, so you kind of understand where this is coming from. But treatments for that reduce the dose. So, consider reducing your dose. If it's something that can be paired with bupropion, oftentimes that is what is done to help because they need a little more dopamine. So it's like this seesaw game that we're trying to do. But if you know me, maybe you don't asking this question, um, you know that I wouldn't go down that rabbit hole of adding more and doing all this that conventional medicine does, because I believe that we end up doing more harm than good. So I like to look at the root causes, look at what else is going on. Why are they responding this way? Maybe we should decrease and look at nutritional support. So doing those labs that I mentioned in the mental health labs video would be beneficial as far as that goes. So, so though there are really no treatments for the emotional blunting except adding something like a bupropion to give dopamine, or some providers will even do stimulants. But again, I think we go down rabbit holes when we do that. As far as now we're adding more of those risks, those side effects, and setting your patient up for treatment resistance and being labeled as treatment resistant and all of the problems that go with that. So what I would challenge you to do is to start looking outside the box and asking asking some deeper questions to your patients. What are they eating? What are their lifestyle choices? How are they sleeping, etc., and try to treat it from that angle versus just going down the pill mill avenue. And I know it's hard if you're in an insurance-based model because that's kind of what we're forced to do. But just something to think about and to question your that type of practice. It's okay to question it and to critically think outside of the box. Okay. So that would be my advice to you. Is it safe to be prescribed two ADHD medications such as a stimulant and non-stimulant? Can both medications be taken together? It depends. If it's just for ADHD, okay. With these combinations, so a lot of times providers will have bupropion and say Adderall, or maybe Vyvanse or something like that, to leverage, more of that dopamine enhancement, et cetera, for treating ADHD, especially when you reach your max dose of an ADHD medication, and particularly a stimulant, and need a little bit more quote unquote help. Though it can be done, I do it with caution if I'm going to do it, because again, like I just said to that provider in the last comment, you have to think of what rabbit hole am I going down, right? And wouldn't it be better to, if you're at, like, say you're Adderall 30 milligrams a day, and doctor, oh, we're maxing out, or maybe you're maxed out at 40 because technically you can do 40. So let's just add bupropion. Well, hold up. Wouldn't it be better to maybe come off of the Adderall for some time, maybe slowly reduce the dose, kind of learn how to manage your ADHD symptoms, and then resume it? And now, now you realize, oh, it's actually beneficial, or only use it when you really need it. If you're working on a long project, or you're, in school, et cetera, having to study, kind of managing it in that way versus going down the path of treatment resistance. Because it can happen with ADHD when you're on so many meds, and then eventually you do have to come off. You can't, and so there is a limit. The other thing is with these other ones, non-stimulant medications, when you're looking at adding something like atomoxetine or Quellbri, now you're dealing with a lot of inhibition, like CYP2D6 inhibition and side effects and things of that nature that you now have to be careful with, drug interactions. And now also serotonin syndrome is a risk. So there, yes, there are a lot of risk. Is it being done by providers? Yes. Is it something that I recommend? No. Look for other ways to help manage your symptoms of ADHD, and also those labs that I talk about in my video on mental health labs. If you have low B12, low folate, though I talk about in the methylation cycle serotonin, it also is rings true to dopamine, via the S-adenosyl methyltransferase, the SAMe part of that cycle. So that could be getting disrupted. So that's what I would be looking at there, is looking at what could be causing your symptoms of ADHD. What is your diet like? What is your lifestyle like? And then going from there. So yes, that it can be dangerous. Have providers done it safely and patients have been safely prescribed to, like, a non-stimulant and a stimulant? Yes. But long term, is it the best treatment for you? Probably not. Irene Neo, can you recommend a dosage of magnesium for anxiety for a woman in her 30s dealing with severe anxiety and depression? I don't want to take any medications. I have PCOS and CPTSD. Okay, so PCOS, you're dealing with hormone issues, probably lots of pain. So with magnesium, when I use is magnesium glycinate, and I start at 200 milligrams and increase it. 200 to 400 milligrams will be the dose for most people. However, I've seen patients use up to 800 milligrams, and personally, like in my practice, I've seen that. In research, 1200 milligrams. The thing with magnesium is if you're taking too much, you're going to know it because you're going to have loose stools. So that's another way to kind of updose until, if your limit, you're going to have, end up having loose stools if if your kidneys are functioning well, excreting it, etc. If your liver is doing what it's supposed to do, that's typically what ends up happening with magnesium. But yeah, so I'd start at 200, to 400, and kind of see your effectiveness about 2 weeks in, kind of gauge how you're doing. And you can also do that dose a couple times a day. It doesn't just have to be in the evening time, though most people use it in the evening because it helps to get them relaxed, to help them sleep. But you could actually, do 200, during the day or in the afternoon, whenever your anxiety is at its peak, and decrease it. But also looking at, obviously with CPTSD, you have trauma. I would look at doing somatic therapies, which is like some body work. There are a lot of great therapists that use yoga and different, like vinyasa type, like slow body stretches and body work to help release anxiety that gets stored in the nervous system as a result of complex trauma. And so that is what I would also recommend to you, going the holistic route. With PCOS, looking at a Dutch test, and Dutch Plus, because you want to also assess your adrenal glands, because a lot of times that can become dysregulated with PCOS, and then see if there's anything you can manage there, because that could also be very, very helpful for managing your anxiety. But I really think with that CPTSD component, if you're not already in somatic therapy, that somatic therapy could really be helpful for you because of the way that trauma gets stored in our bodies and our nervous system. A good book that helps to really put this in perspective is The Body Keeps the Score, by Bessel van der Kolk. That book is a very good book that it kind of explains a lot of this. But yeah, so look into some of that too. I hope I answered your question, Irene.